I had no idea that somebody could talk to me about heart transplant. My heart could be completely failing and then have it completely recover because of the Impella. It's like mind-blowing.
An Oregon mom is back in good health after nearly losing her life to a rare complication from COVID. At first, she had mild symptoms, but in less than a day, she was in the hospital having conversations about a possible heart transplant. I talked to her about her condition and the message she has for others about heart health.
I have an 8-year-old, a 6-year-old, and an almost 2-year-old.
For Mom Hillary Steffen, her heart is always with her family.
My husband's a firefighter paramedic for Salem, and I'm a stay-at-home mom right now to 3 kids.
But it's her heart that almost took her away from them.
Nobody would know looking at me that I experienced acute heart failure. You know, I have scars and I have the internal recovery is a lot more difficult than the physical recovery.
In November 2021, she came down with COVID-19. It started with a fever and mild symptoms, but within 24 hours, things took a drastic turn.
I woke up in the middle of the night on all fours and my arms were tingling and numb.
The next day, it was worse. Her husband tried to take her blood pressure, but couldn't get a read.
So he was like, we've got to get you to the hospital.
The healthy and active 33-year-old mom was in cardiac shock. Rushed into surgery, doctors in Salem gave her an Impella heart pump, but she needed a better solution and was moved up to Providence St. Vincent in Portland.
Between both Salem and then them calling Providence and having that connection and rapport with one another is honestly probably what saved me.
It turns out Hillary had myocarditis, an inflammatory condition of the heart which can be caused by any virus.
Other types of viruses, but also like COVID, and that can lead to dysfunction of the heart, weakening of the heart function, which can lead to, low blood pressure, shortness of breath, chest pain, and if it becomes very severe, it can become life-threatening, as it was in her case.
Dr. Jacob Abraham is the section head of the Advanced Heart Failure Program at Providence St. Vincent Medical Center. He says, fortunately, severe cases are rare, but many people don't seek medical attention right away.
Given time, but oftentimes, as in her case, patients can become very, very ill to the point that if they're, not in a setting where they can receive appropriate care, they could actually pass away. So Hillary was fortunate to get timely care and aggressive care.
At Providence St. Vincent, she was given a larger heart pump, but was told if she didn't recover, she would need a heart transplant.
I felt a little overwhelmed by that, but I also felt like I was already in survival mode and I couldn't really start processing that yet. One, I didn't know if it was going to happen, but I didn't want to think about somebody having to die in order for me to live. And that was really difficult.
Luckily, it didn't get to that point.
What was incredible is that after about 2 weeks with the Impella in, my heart fully recovered.
After weeks in the hospital, the heart pump was removed.
And 3 days later, I was out of the hospital.
It all happened very fast, and she says much of it's a blur. She was in and out of consciousness in the beginning, and then was put in isolation away from her husband because of COVID.
I joke with him a little bit that he had it worse than me because he knew everything that was going on, and I was sort of in and out of consciousness through the whole thing, and everything was tanking and he couldn't figure it out.
But while she was recovering in the hospital, her hubby was nearby.
Through the grace of amazing family friends, they brought their RV trailer to Providence, got a permit through the city of Portland, and he parked there and stayed there.
Once she had the strength to get out of bed, she'd move to the window, looking out at her husband to chat on FaceTime.
So that was the best. I looked forward to that every day because it definitely can become lonely all by yourself in there.
And to let others know they're not alone, she's connecting with people on social media, sharing her story, her knowledge, and that strength of heart to offer hope.
And I want them to know that heart recovery is possible and to be able to have hope seeing my story and hearing that I was able to fully recover and I'm healthier now than I was before that.
Now, when it comes to cardiac shock and heart attacks, symptoms can present differently in women than men. It's not always chest pain. Women are much more likely to have less common symptoms, things like indigestion, shortness of breath, back pain, sometimes even without that obvious chest discomfort, which was the case for Hillary.